The election isn't far away, but already we're seeing the major parties make their positions on Medicare clear. This week, opposition leader Anthony Albanese committed Labor to, quote, maintaining a well-sourced public health system with Medicare as its backbone, while the government was claiming last week that Medicare is supporting more Australians than ever. The health minister says that almost 9 out of 10 GP visits are now bulk billed, which means they're free. But an expert in medical billing challenges that figure. She said many of those bulk billing claims by our doctors could actually be illegal. Stephanie Bolci has this story.
Last week, the health minister boasted that about 9 out of 10 visits to the GP were effectively free, with no out-of-pocket costs.
That is a great, huge falsehood. If correct bulk billing has happened, the patient should walk out the door having not handed over a cent for anything.
Margaret Foe recently did a PhD on Medicare billing, and she says that only about 30% of bulk billing would actually be done correctly.
Complexity has increased, support has decreased, and the one tiny skerrick of control and visibility the government had over Medicare bulk billing was removed in the last 10 years.
Dr Foe says most of the fraudulent claims, though, wouldn't be intended, but a result of ignorance. She's a founder of an app that does Medicare billing and is also a lawyer, so comes across this confusion on a regular basis.
Just recently I had a conversation with a doctor who said to me, we charge $90 to our patient and then we get the rest from Medicare. To which I reply, what do you mean the rest? There is no rest. Another practitioner the other day said to me she charges $20 to every single one of her patients and then bulk bills them.
Often when health professionals are corrected, Dr Foe says they opt never to bulk bill again. It's a trend that the Royal Australian College of General Practitioners is also seeing.
They've been so overcome when they've realised that the way they've been billing for months, years was wrong. They didn't know. They immediately want to, be handcuffed and put in jail.
So what's the solution to fix Medicare billing issues?
That will require a multi-pronged approach across 3 domains: regulation, education, and digital reform.
Priya, you're a doctor. What earthly excuse can a GP have for not knowing the bulk billing rules? This is hardly new, this system.
It's not new. I have to say this, that the billing rules are actually a lot more complex than people probably realise. And as a profession, health professionals, and I can talk for GPs definitely, we're actually not that business savvy, honestly. I will wear that myself. But we don't really have a huge amount of education on how to bill the Medicare system. And what you need to remember is, particularly in the pandemic, we have been doing modules trying to get up to date with the COVID vaccines. We're now talking about Japanese encephalitis, COVID therapies in the community, updates in the asthma guidelines. We have been really, really under the pump, absolutely swamped. And it hasn't left much time for us to actually get up to date with the new billing rules that have come out from the government, with telehealth, long consults, short consults. Can you do a mental health care plan if the patient has been in the last 12 months? It has been complex. And so in that package, it said ignorance is the main problem. And I think it's a lack of education. I really, really do.
Yeah, fair enough. I mean, I understand there's lots of different things you can bill for, but the basic premise is if you're bulk billing, then you're not charging someone as well, because that's not how it works. I mean, it seems to me maybe a lot of doctors might be doing that because they think they deserve a co-payment because, the bulk billing, they don't think them is enough. But, it's not a hard rule to get a grasp on, is it?
No, it's not a hard rule, and I don't quite know how that's working on the ground, or how this co-payment system is potentially working in other clinics.
But there's not a co-payment. I mean, there's no co-payment system.
No,
Governments have talked about it in the past but never done it.
And I think that some GPs have probably misinterpreted what bulk billing actually means, that the patient walks out the door having paid absolutely nothing out of pocket.
Yeah.
Now, what some GPs are clearly doing is charging some form of gap, which is not bulk billing. That is now called private billing. You are asking the patient to give you something out of pocket. But I have to say this, just for some, and this is not what we're doing at the clinic I work at. I read this article going, oh my gosh, I hope I'm billing correctly. I had a bit of anxiety. But honestly, we need to remember that the Medicare rebate for GP consults was frozen in 2013 by Labor, continued by the Coalition. $38 is what a GP will get for a standard consult. That's the same as what they were getting in around 2014. The cost of running a clinic, Fran, has exponentially increased for nursing staff, receptionists, bandages, syringes to get COVID vaccines into arms, all these things. And the rebates haven't reflected that. So when the Grattan report comes out and says, you know, patients are paying more than ever out of pocket costs, this is ridiculous. Yes, it is. But how do we reduce the costs to the people on the ground, the community, the people who need healthcare the most? Well, those rebates have got to lift. And we definitely need education. Doctors, I'm telling you now, we are not savvy business people.
Okay. No, look, I understand the temptation. $38, and as you say, has been frozen for a long time, but nevertheless, the law is a law. The government, the health minister said last week that almost 90% of doctors' visits are bulk billed, and I think that would be news to an awful lot of people in an awful lot of places around Australia where you can go a long way to find a bulk billing practice. What percentage of your patients are bulk billed? Does that number surprise you?
That number really surprises me. So I work in a mixed billing practice where we privately bill a large proportion of our patients, but anyone who has a healthcare card or is under 16 is bulk billed. Now, I would not agree with the figures that were stated by the Health Minister, and I know what my friends and colleagues are doing in their clinics, and I don't think that that figure is true, and we've heard in the package that it's not.
All right, we're going to take you as an expert tonight and move on. You're watching The Drum, and with me on the panel, Industry Professor at Jumbunna Institute of Education and Research at UTS, Noreen Young. Also tonight, Prue Clark, Executive Director of New Narratives, a not-for-profit that aims to support independent journalism in developing countries. In Brisbane, Senior Lecturer at Griffith University, Shahram Dana, and in Melbourne, General Practitioner Dr Priya Alexander.